Everybody, my name's Tyson. I'm the owner of Scolvin Distillery here. Welcome to the Crystal Ball. We're gonna make a iced Thai daiquiri. And you're gonna start off, you wanna take a coupe glass or whatever glass you have, put it in the freezer to chill. I've got a little liquid nitrogen. You've got a lime, you're gonna need to juice that. Simple syrup, you'll have that in a bottle. The iced tea, and then our rum. All right, you should have all the ingredients, and what you'll need is a jigger. It's a tool to measure cocktails. If you don't have one of these, just tablespoons will work. 1 ounce is equal to two tablespoons. So we're gonna start off with our lime juice, in whatever order, it doesn't really matter. We're gonna do a 1/2 ounce of the lime juice. So a 1/2 ounce is 1 tablespoon. So it's a 1/2 ounce of simple sugar. A 1/2 ounce of your Thai iced tea. And then 2 ounces of our white rum. So if you need help with those conversions of the rum, that's 4 tablespoons. If you're a little bit more, a little bit less, with this cocktail, it will not matter one bit. Now you've got that all in your glass. You're gonna fill that up with ice. What I like to do is use the largest chunks of ice that you have. Use a couple of those, one big, one small. Whatever you have will be fine. And when you shake this, you're gonna shake it until that container is really good and cold. Obviously, if it's a Tupperware container, you're not gonna be able to feel it as well, but just shake it. Really, it doesn't matter as long as you just get it nice and cold. Enjoy. Cheers.
Good evening and welcome to the 20th annual second virtual Mercy Hospital Foundation Crystal Ball. I am Beth Johnson, oncology social worker and licensed therapist at the Allina Health Cancer Institute at Mercy Hospital. I truly love my job and was honored to represent the hospital and my colleagues here tonight.
And I am Dr. Saul Singh. I've been a hospitalist at Mercy and primarily Unity campus for the last 15 years. And I am also honored to serve on the Mercy Hospital Foundation Board of Directors. Beth, you have presented the Grants Review Committee Foundation many times over the years to request funds for cancer patient emergency funds and other initiatives related to our oncology care. We also voted yes to the use of those funds.
Mm-hmm. And actually, Dr. Singh, you and I met years ago when I first started with Allina. I was an inpatient social worker on the unit at Unity, and I clearly remember having a family consult meeting with you, and you were so compassionate and caring, and it just reaffirmed to me that my work at Allina was going to be an incredible experience. And so our relationship has come a long way. We're much fancier tonight, so this is very exciting. So I love that I get to team up with you tonight. We both have a passion for the care that we provide at Mercy, and I respect the importance of philanthropy to our work that we do in caring for our patients. Most years, you and I would be sitting down at a table for a nice dinner in a ballroom with all of our friends around. Either way, we are here to raise money with your help.
While we are not together in person, Beth and I have dressed the part and are excited to bring you a compelling program while raising needed funds for oncology programming. Tonight, you will hear from many people who have been impacted by Mercy Hospital, inside our walls and out. We encourage you to participate in a way that is meaningful to you tonight, bidding on our many amazing auction items, donating directly for upgrades to our units and whole person oncology care, or both. Last year, we gathered virtually, and our impact was amazing. You donated to bring a PET scanner to campus for cardiac care. The project is underway, and the new technology will be in use this coming January. Tonight, we even hope more people are watching and ready to make a difference. However you are inspired, I hope you know together we can and do change lives.
So as we begin this evening, here are just a few logistics for you. As you navigate the event page, the festivities are best viewed as a two-screen program. So use your computer or your TV for watching Dr. Singh and I here, and a phone or a tablet for bidding and donating. Our auction is filled with items that you need, I promise, for men, women, families, kiddos. I am probably going to bid against you, Dr. Singh, because I heard you talking about the ice cream truck for your son, and I'm like, I'm pretty sure I'd be the cool mama if I got that for my son. So we might have to do like a battle royale over the ice cream truck.
Well, I have to tell you, I have a secret weapon. My wife's at home tapping away.
Those wives, she's just making it rain all over this event. I love it. So one thing to note, bidding will close at noon tomorrow, so make sure you bid high and often. If you are the winning bidder, you will receive detailed instructions on getting your items. You can also see the auction pickup items on the auction rules tab of this site as well.
As we share stories of the impact your gifts can have on Mercy Hospital Foundation, please consider making a cash gift by using the donate button and giving at whatever level is meaningful to you. This year, we have a significant match to meet of $100,000 provided by Ramsey Lyons and Chris and Naomi Hasling and Ruth Bauhorn. Also, Glenn Flatterbow from Flatterbow Advancement is with us to assist with our auction and fund a need. Thank you, Glenn.
Dr. Singh, it is great to be with you. Beth, thank you for emceeing tonight. To everyone at home, we're so excited that you're with us. Matter of fact, we have watch parties all across the community. In a few minutes, you're going to see pictures of the watch parties, but we are sincerely appreciative for all that you've done. Tonight's Fund a Need is so important. We are going to address and tackle the financial burden of dealing with cancer. And as Dr. Singh just said, we have a remarkable match tonight. We have a $100,000 match. So every gift is matched dollar for dollar up to $100,000. Beth, I'm looking at the screen. We are currently at $154,810 towards our $200,000 match. So really what that means at home, all we have to raise is about $22,500. And then with the match, we will make it to $200,000. We are going to address financial burdens dealing with cancer tonight. Beth, I know you're going to introduce her, but I do want to say one word about our CEO, Penny Wheeler. I think the world of her. We are blessed to have her leadership, a remarkable person. She is watching from home tonight, so the pressure is on us. But why don't you introduce Dr. Wheeler?
Thank you. So at this time, it is my honor to introduce Dr. Penny Wheeler, our Allina Health CEO, to the program, as she talks about Mercy Hospital, part of Allina Health, and she shares about this past year in oncology care.
So I'm Penny Wheeler, and it's with great pleasure that I welcome you all to the 20th Annual Mercy Crystal Ball. The work that has been done over those 20 years has just been magnificent. We're virtual again this year for the second time in a row, but it does allow us to connect to people who have to be home or are geographically separated. So I guess we'll take the advantage of that. That said, we long for being with all of you together. And a huge thank you for what you've done, not only the past 20 years, but what you'll do this year. We think this is an incredibly important thing for the Mercy community to really tie cancer care together and support it for all. And you have an opportunity to support us in that work tonight. Can't thank you enough for the long-standing relationships we've held with you and the new ones that come into this virtual setting today. And thank you for all the support you give your community, and with this hospital being a key role in that. Thank you.
Thank you, Penny. Penny touched on the reason why we are virtual this evening, COVID. I'm glad that we are now able to move about more freely and safely. For me, COVID has been quite a challenge. It's been a challenge to all of Mercy Hospital. And I must tell you, the staff rose to the occasion. Everyone pulled together and did everything we needed to get the job done and provide the care that we needed to the community. And I have to tell you, the quote that rings in my ear from my colleagues when we show up at work, that this is my family away from my family. We all showed up, took care of every patient to get them the right care at the right time. Let's go ahead and take a look at a video from our staff at Mercy Hospital.
Mercy Hospital was a busy hospital during COVID. Our care of COVID patients was very significant. 10% of all COVID cases in the state that were patients that needed to be hospitalized happened here at Mercy Hospital. That's a significant role that we played in the community during this pandemic.
The safety and security of our staff are paramount, so we scrambled, as you remember, in the early stages to get the protective equipment for the staff we needed.
And they came back day after day. They were tired many days, and they really did everything they needed to keep each other safe, to keep our community safe, and to provide care during a very difficult time.
It really brought us together as an Allina family for how are we going to get through this as an organization to absorb as much of the pain of COVID so that hopefully it doesn't trickle down as much to our patients. And I think we tried really hard to do that each and every day, but just trying to bridge the gap. And I know that so many of our nurses and doctors and nurses' aides and housekeeping and everybody over at the hospital were trying to fill the gap.
It's been very emotional, especially with our oncology patients, who we have very strict visitor, policy.
They took not only the role of caregiver, but they oftentimes took the role of being with someone whose family couldn't visit them in the hospital, and sometimes with those who were even dying. And that was an additional responsibility that they really owned, and I don't know how people could have gotten through this without our wonderful caregivers.
I'd like to tell you that video gave you a glimpse of what went on in the walls of Mercy Hospital. But there were so many more people involved that all pulled together, and we'd like to express our gratitude to all the staff that took care of the patients during this crisis.
Watching tonight is very emotional, especially for me. While I came to the hospital and our oncology clinic from time to time throughout the pandemic, a lot of my work moved home as well. Despite the upheaval in all of our worlds, here at Mercy, we actually moved forward with opening the Allina Health Cancer Institute on campus across the Skyway from Mercy Hospital. We built through the pandemic and actually saw our first patients in the new space this past January. I am so proud of the vision and goal and the outcome for our community right here in Anoka County. As soon as you walk in, you feel like this is a safe space to be. And I think with all the support services, with how well connected our staff is, people really feel that we're gonna hold your hand until we get you to the next person. They'll hold it and walk you through it till you get to the next person. And I just don't feel like that is everywhere. But it is absolutely here because I see it and I'm a part of it every day. We have your doctors and your nurses getting your physical body through treatment and as safely as we can. And then I'm here to try to get your emotional and your spiritual person through treatment as well.
What's being built here, I think, is very, patient-centric, patient-focused, and will be a, shining star for the Alliance Cancer Institute.
So I think that what's special about oncology care at Allina Health is that it does do our very core mission of surrounding people with all the care that they need so that they feel loved. It's not just a transactional, you have cancer, we will do this. It's like, oh, let's think about this. One of the patients I talked to, her name was Rachel, she said, when I got my cancer diagnosis, it was like dropping a 1,000-piece puzzle onto the floor. Just shows to our care team. Whether it was a nurse navigator, whether it was somebody who was helping her deal with how to talk to her children, whether it was how to stress manage this around there, whether it was the treatment needs, whether it was making sure that she got the imaging scheduled right, all those things were coordinated well together. And she said the pieces of the puzzle were picked up because of that. So what we really want to do is we want to tie all these things together in our whole person care approach, and that's why we excel and why we're different. Unfortunately, the cancer needs in our communities are going up with the numbers of cancer diagnosis. We want to do it in the right way, where we deal with all those aspects of care that help people feel whole and be whole and contribute to their healing.
At Mercy, we treat our patients like family. No matter why you come to us, we really treat everyone the same, and we take every patient as one of our own.
So the next video features our longtime oncology volunteer, a former patient, and my very dear friend, Dennis Seifert. Volunteers left in March of last year due to the pandemic, and we shot this video the day Dennis came back to see our new oncology clinic for the first time.
So what are you doing here today?
Well, today, Beth invited me originally to come in just to show me the progress made. I'm very much hoping to get back to volunteering soon here. And I just wanted to see what was going on and what the new spaces look like. And with having been on council, I was eager to see the real thing, other than just pictures or drawings.
And what did you see?
Oh, this is amazing. This is so nice to see it all put together like this. The amount of space available compared to what we've been used to working with in the past is amazing on it. Very nice. The colors, everything is very good. This is, from where we were.
We were in that little teeny suite
This is
that was like a
amazing.
circle with just however many offices, and now we take over the
Yes.
entire floor. Everything is under one roof.
If you had a friend who's facing cancer, what would you tell them about the care they're going to get up here?
Well, first of all, they're not going to find better care anywhere. It's the best of the best. It really is. These people are on the high end of the professional jobs that they do. They're very good. It's an easy place to come. There's always people available. If you need to see Beth for something, she'll make herself available. If you need acupuncture, they'll figure it out for you. They're always working with you to make your journey as gentle as possible, because the cancer is already bad enough to deal with. And so anything that can make that a little softer, a little less painful, if you can put a smile on somebody's face for that day, it's worth every minute. It's worth every minute.
Tonight, we are raising funds for both programming and upgrades to space. As a hospitalist, I work in the hospital 7 days on and 7 days off. As hospitalists, we interact and care for every patient. We visit many units in the hospital, and I can tell you many spaces throughout our campuses need upgrades. Does this impact care you receive when you come to see us? No. But indirectly, it impacts how we work, where we spend 8, 10, 12 hours, day shift, night shift. Care is the center of what we do, and that always shines through.
So yeah, when I started here on this exact unit in 1989, this exact desk was here, and very little has changed. So yeah, I'm not sure that the environment exactly shows the kind of care that we give, because the care that we give is amazing.
Well, let's start with exactly what we're looking at right here. This little piece. It's not really stable, but I mean, when you're working, your environment is a big piece of it. I mean, to avoid distractions, not having to run or, bump your toes into.
Here we go.
It's not funny, but.
No, I mean,
Can't wait for the new desk because then appears, first impression, I would say.
It's the first thing that you see on the unit, and it's the first thing patients and families and new employees when I'm interviewing sees. And just to walk in, and I would never want anyone to have some sort of doubt in their care because of the way that our facility looks, because it doesn't correlate one another. I just don't think people understand how much staff, how much they appreciate it and how excited they are. They have been asking for this since I started, and they have been asking before I even started. And when I was able to share the news with them, they were overjoyed and wanted to make sure I wasn't tricking them. But it's just gonna make a huge impact, and especially after this year, the first thing that they walk into every morning, they get their assignments and just have a better feeling to start their shift.
And a huge thank you to our patients and staff for sharing their powerful stories. My friends at home, now's the time that I ask you to join us and make a difference. The specific program that you will fund tonight is piloting an oncology financial navigation program for patients. You see, and I think all of us feel this and know this, cancer is not only toxic to the body, it is toxic to a family's finances. Tonight, with your help, we can assist our patients and help them steer through the process and help them save money. In just a moment, you'll hear more of the stats, and the stats are devastating and overwhelming, the financial burden of dealing with cancer. But the piece that I thought so much about in preparation for tonight, in the importance of this funded need, is the stress that we're putting on patients. We are going to address that stress. The stats certainly tell us about the importance of this program and work, but there's no way better really to understand than to hear from somebody who's personally experienced it. And Mike Krosick, who's the Vice President of Allina Health Oncology, he's going to come up and share his story, his personal story, and the vision for our patients. Mike, it is great to have you here tonight.
Great to be here. Good evening. My name is Mike Krosick, and I serve as the Vice President for Oncology for Allina Health. I'm truly honored to be here this evening to address a very needed service to truly differentiate our cancer services, providing comprehensive oncology financial navigation to all patients in need. For me, this is both a service and it's very personal. As a priority, I've been leading cancer programs for over 20 years, but I've been personally challenged by the financial burden of cancer in 2007. Despite great coverage with deductible and co-payments, I still had over $88,000 in out-of-pocket expenses related to a cancer diagnosis, which became a multi-year burden for my family. For me, the financial burden of a cancer diagnosis was higher than the battle itself with the disease. Looking back, I sure could have used those robust resources available now for patients, including pharmaceutical co-payment assistance, drug replacement, navigation, resources available, which would have cut my out-of-pocket expenses by almost half. I know I'm not alone, though. According to the National Cancer Institute, almost 40% of men and women in this country will be diagnosed with cancer at some point in their lives. And Americans with cancer experience higher out-of-pocket costs than do patients with any other chronic illness. In addition, 50% of our patients will report catastrophic levels of financial hardship. Compared to even 10 years ago, patients receive more expensive chemotherapy and other new types of treatments. To truly differentiate our growing cancer program in the community, our goal is simple: to have a comprehensive financial navigation program with multiple step approach addressing the issue of financial toxicity in patients with cancer. First, we want to acknowledge we're understanding the problem. Second, we're quantifying the problem. Third, engaging key stakeholders and fostering communication. And fourth, implementing multiple solutions at various levels during the cancer treatment journey. Our goals for oncology financial navigation are simple. It is about improving access to care, eliminating the stress or minimizing it, the reduction of financial toxicity, the reduction in bad debt and charity, and of course, increased patient satisfaction. Financial toxicity is not a policy issue at Allina, but a real clinical problem with adverse consequences to the patient and families. We may not be able to prevent or cure cancers completely, but we will be there to prevent or minimize financial toxicity with the tools and the support available for our patients served. A big thank you tonight for all your support.
Mike, number one, I want to thank you personally for being here, for sharing your story, for your leadership at Allina, for all that you're doing. And by the way, I want you to stay with me. I have two questions to ask, but we are making progress. We're at $165,910, so we've raised just over $11,000, close to $12,000 since the program started. We're going to get to $200,000. We are going to do this. Two things, though, that I want to talk to you about. And I had the chance to do a Zoom with you this week to talk about the importance of tonight. Number one, people are really in two crises. They're fighting a medical emergency and they're fighting a financial emergency. And this effort tonight will allow them to focus more on their care. Won't it help simplify and focus?
Amazing. We know from a patient experience mapping that the financial toxicity is even more stressful than the diagnosis itself. We're all touched by cancer, and we're going to be there from diagnosis to survivorship, but let's minimize the financial toxicity of that trip.
The second piece, when folks are thinking about tonight and our goal of getting to $200,000, a big portion of what you're funding is a financial navigator. And it's a part of what we're funding, and there's many other things, but the financial navigator, this is a person that will help patients navigate the process. And Mike, I want to ask you this. I think of the stress on somebody. The stress of being at home, not knowing what to do, what forms to fill out, what grants to apply for. Won't this specifically be incredibly instrumental to have somebody that will pick up the phone and be there to talk to somebody?
Of course, and all points of the journey too. Proactively in the front and all through the journey, we want to be there to address insurance optimization, co-payment assistance, drug replacement, all these resources that have been available for years. We just want to maximize it to reduce or minimize any of the burden related to finances.
So Mike, I want to thank you again for being here tonight, for sharing your vision, your leadership, your personal experience. We're going to do this together. And to everyone at home, right now in this moment, your gift will change outcomes for our patients and staff. It'll make a difference. I've watched our scoreboard increasing throughout the program, and I'm excited to announce, and you heard it earlier, but I want to give you a little bit more detail about the funded need you're supporting tonight, which is financial navigation for oncology patients. And tonight, which is remarkable, we have a $100,000 match. $50,000 of the $100,000 came from the Ramsey Lions, who are generous longtime supporters. $30,000 came from community members Chris and Naomi Hassling. And $20,000 literally came in yesterday from Ruth Bauhan. So they've added their gifts together. All of these gifts together are $100,000, which means, and it's gone up right now, we're at $171,510. So if we raise about $14,500 with the match, we are going to get to $200,000. Chris, by the way, is also past chair of the Mercy Hospital Foundation. I know he's watching. He has a house party tonight. Chris and Naomi, a huge thank you to you. Folks, every gift right now is doubled. Now is the time to grab your phones. You can hold up your phones at your house parties. You can make a pledge together. You can watch the meter go as we work together to close that gap and get to $200,000. And as everyone's pledging tonight, let's take a look at who we are at Mercy.
Your gifts tonight, your participation, your contributions mean more than you can know. When people give to Mercy Hospital and to Allina Health, you tell the community, you tell Allina Health that you're behind us, that you're committed to us. You tell our teams and our caregivers that you believe in us. And that is a message that means so much.
We literally could not do it without you. And I just thank you from the bottom of my heart. Thank you.
Thank you for your support of Mercy Hospital Foundation, oncology care in the Northwest Metro, Mercy Hospital, and our community's health. Your support is necessary and it is appreciated. Thank you.
Thank you, thank you, thank you.
Let me just conclude by saying this. Thank you isn't even a big enough word anymore for what our team members have done in service and support of the community when it needed their care the most. It's also not even a big enough word for all of you out there who continue to support us through your words, your actions, your gifts, your generosity, everything in ways that you have supported us. Big thank you. Wish there was another word in Webster's that was even grander, because it seems insufficient now for all we have accomplished, and I mean we, all the people in here and all of you out there together to heal our communities collectively. Thank you.
This is the time to go online and give now. Thank you.
Look at this, everybody. We are making progress. We're at $176,485, so less than $25,000 left to raise. Listen to all these names. A huge thank you to Mike and Rod and Tom and Terry and Joseph. Joseph, by the way, I miss seeing you tonight. Chris, the list goes on and on. Beth, I'm reading all these names. Anoka Rotary Foundation has made a gift tonight. Becky, Robert, Falcon National Bank, Dan Holler, again, Mandy, Mercy, medical staff, Jim, John. Thank you, everyone, for all that you're doing, for all that you're pledging. Matter of fact, as you're pledging, I was thinking about this. The number of families that will rely on this in the coming year, and the thought to have that resource for them, it'll be so important. I'm imagining it right now. Our oncology staff must be super excited watching this. Beth, Dr. Singh, don't you think this is amazing? We're making progress towards our goal.
Oh my goodness.
Absolutely.
This is so exciting. We are so grateful for the support of this community. I'm sure my colleagues watching from home are cheering, my husband, maybe even tearing up. Many of us have worked together for such a long time, and this is a very special night which will make an impact on our work on a day-to-day basis. And I'm excited to see everybody tomorrow.
It is so much fun to see camaraderie in these photos. I saw some of the board members in a bunch of these shots. I know Bruce, Chris, and others are hosting at the TPC. And committee member Susie Yu has a gathering in memory of Dr. Yu, who died from cancer several years ago. I know Dr. Yu's here with us in spirit. Diana and Dr. Chambers invited guests too, just to name a few.
So a big shout out to all the watch parties in the community. I hope you're ready to start getting bidding. Get those phones out if they're not out already. My husband Zach at home, we've talked about the things that we need to be purchasing for our family, so start getting ready on that one if you haven't already. So thank you, everyone. Please continue to hit those donate buttons as we begin to discuss our premier auction items. So to kick it off, we're starting with a fishing experience with outdoor icon Ron Shera. So I live on a lake. I'm one of those people, like, I can look the lake part, I can act the lake part. I'm not like a fishing guru, so this would be a perfect thing for us to bid on. The winner of this will receive a half-day fishing experience with Ron Shera at a lake in the metro area. It includes you and a guest on Ron's boat, and the trip is valid all the way through the summer of 2020. So this was really popular last year, and we're thrilled that it was donated again by Ron Shera Enterprises.
So a huge thank you to Ron Shera. Matter of fact, there's been a lot of bidding in the last couple minutes on this. Matter of fact, Ron sent us a quick video. Let's roll that video from Ron.
All right, want to catch a fish? Now is your chance. Yes, you can bet on me. Hop in my fishing boat if you're the winner, and we'll spend a half a day of fishing some lake around the Twin Cities, or maybe as far away as Mille Lacs. We'll go where they're biting, okay? Because I like to catch fish too. I'll provide all the fishing equipment. We'll go for bass, most likely. You can bring your own treats, maybe some for me too. Anyway, we'll have fun, I promise. So join in.
So I'm looking at the bidding right now. The current bid on the fishing experience with Ron Shera is $750. Zach is bidding right now. Beth doesn't know this, but she has just agreed to clean the fish. So thank you, Beth. Thank you, Dr. Singh. You're also going to help clean the fish.
It won't be done well, but we'll have fun.
Yes, that's the value of doing this live, is that we can add those things in the moment. Again, all of the bidding is open until noon tomorrow. The second item, Dr. Singh, I love this trip. Tell us about our second package, which is a trip to Colorado.
Sure. Next up is a one-week trip for those of you always looking for escape from Minnesota. This is a trip to Colorado in the beautiful two-bedroom unit at the mountainside in Silver Creek Condominiums in Granby. It can hold up to 7 people. It's near the southwest entrance of Rocky Mountain National Park with skiing nearby. The package is available through next July, includes a $1,000 Visa gift card for travel expenses. Thank you to Kraus Anderson Construction for this donation, and I'm sure my wife is looking at this and thinking about our getaway.
All right, everybody, this Colorado trip, I do want to spend just a moment on this. This is a big deal. Matter of fact, in my line of work of doing these charity nonprofit events, Colorado is one of the strongest trips that I sell. The current bid is $2,700, and you're getting the $1,000 Visa gift card. Kraus Anderson, a great Minnesota company. They're a builder, of course. They've done so much for our community. A huge thank you to Kraus Anderson. Anyone who buys this less than $5,000, it is a great buy. So bid on this package. It's an awesome item. Our next item, Beth, this is cool. We've had tons of bidding on the boat in the last 30 minutes. The current bid is $3,500, but tell us about the Lake Minnetonka boat experience.
So next up, it's a private cruise on Lake Minnetonka. So you're going to be on this large, beautiful yacht, 30 guests. Think of all your friends. I'll invite you if we end up getting this. So 30 guests will enjoy an evening cruise with appetizers, a cash bar. Huge thank you to Paradise Charter Cruises, Susie Yu, for donating in memory of Dr. Yu.
All right, everybody, keep bidding on the boat experience. The more you bid, the more fun it is, by the way. So if you go to $100,000, it will be the trip of a lifetime on the boat. It's a great package, a ton of fun. This next item, super cool item, you're going dog sledding. Dr. Singh, have you ever been dog sledding?
Not yet. But
Tonight's the night.
Tonight's the night. This is definitely on my bucket list, and I have to tell you, it's a great Father's Day gift for those of you that haven't picked out a gift yet. This is a dog sledding trip in Ely. You and a guest will enjoy a half-day dog sledding tour. This package includes one-night stay at the Grand Ely Lodge with $250 towards your stay and an additional $250 Visa gift card. This trip expires in March of 2023, so please go ahead and put in your bids.
All right, everybody, that's a big deal. You have until March of 2023 to use it. Again, a huge thank you to Teresa Malone, Grand Ely Lodge, and the Friends of Mercy Hospital Foundation for this item. The current bid's $1,000. It is a amazing experience. Dog sledding is truly remarkable, iconic Minnesota experience. Have fun bidding on that package. Our last premier auction item, this is cool. Not only is it a private experience, but he also has a connection to Mercy. Beth, tell us about our last package.
This one is so special. So our final premier item, and it's final for a reason, just to have extra focus on it, is 2 hours of incredible music from the talented David Sutton. And David actually sent us a video, so let's take a peek.
Hi, my name is David Gerald Sutton. I'm a violinist here in Minneapolis, Minnesota, and Dr. Yu is a huge fan of mine. I was thankful not only to have known him in life, but to have performed for him at his birthday and in honor of him at his funeral. In the spirit of his love for my work, I am donating a live performance to this year's Mercy Hospital Foundation. I play a 5-string violin, and I utilize effect pedals and recording devices to become a one-man orchestra. Think of a violin sounding like a drum, a synth, a guitar, or even the entire stringed instrument family of violin, viola, cello, and bass. Now think of all those sounds being layered and recorded live in real time in front of you. It's an experience that can only best be felt and heard in person. So, why not bid for a private home performance? Maybe you need a soundtrack for your wedding or for a corporate event. Whatever it is you have in mind, I promise to make it an unforgettable experience, just as Dr. Yu is an unforgettable human being. Thank you.
David, a huge thank you to you for sharing your talents and support tonight. That is a great package. The current bid is $300 on that. Good news, everybody. Listen to this. We're at $179,285, so we'll put that up on the screen. We are less than $21,000, so about $10,000 with your support, and with the match, we will get to $200,000. We want to thank everyone tonight for their help, for their generosity. I want to personally thank you for all that you're doing for patients, addressing financial needs and with their cancer care. We're going to do this together. Thank you, Beth and Dr. Singh. Thank you for emceeing. We're going to get to $200,000.
Thank you, Glenn. Of course, the auction is filled with many more items, too. I am bidding on an ice cream truck. My son said, Dad, make sure you get that ice cream truck. And we're also looking at cupcakes. There's a custom-made cake and cupcake. My wife always likes dessert, so I'm throwing a bid in there. Beth, what do you have your eye on?
So I was going to say that I'm still going to challenge you on the ice cream truck, but that seems a little mean-spirited, so maybe we partner together and we really make it a joint Mercy family experience because our boys are the same age, and it'll just be a huge party with ice cream and cupcakes and the jewelry, husband, that I was also looking at. So who doesn't want to eat ice cream with new jewelry on? So that might be my other piece.
I like it.
Okay, perfect. So keep on bidding. We have until noon tomorrow. Your bidding equates to proceeds for programs I work with directly. So now before we close, we would like to honor our fantastic sponsors verbally and visually. So Metropolitan Heart and Vascular has been a $35,000 sponsor for many years. Thank you.
At $25,000, Midwest Radiology, and $10,000, PSD.
Knutson Construction, $8,000 sponsor. And at $6,000, Connexus Energy and the Hospital Pathology Associates.
And thank you to all of our remaining incredibly generous sponsors noted on the screen. Your support means so much to us. You are true leaders in our community. To each and every, as home participant, thank you for joining us on this virtual program. On behalf of the foundation staff, Linda, Andrea, and Lisa, the Mercy Hospital Foundation, Board of Directors, and the Crystal Ball Committee, we extend our gratitude for your gifts.
So I want to say thank you on behalf of the oncology team. It means so much to know that we have such amazing support from this community. Okay, so I was gonna ask someone to pour me a drink, but Andrea read my mind, and here we go. So she poured me the signature Skolven's cocktail, and I just have to say it has been a thrill, definitely out of my comfort zone. to lead you through this evening and share the emotional aspects of our work that we do day in and day out. But my job tonight is complete, so stay tuned for a David Sutton performance recorded just for this crystal ball. Enjoy a thank you reel and photos from our watch parties that are happening tonight all across the Twin Cities. Thank you again, and keep on bidding until noon tomorrow. Have a great night. Cheers.
and giving.